Welcome to the Dr. Berkson's Best Health Radio Show. And I have a guest on the show today that is a pleasure for me to have because he's somebody that I've known for many years. We're friends as well as colleagues. Kurt Vonnegut once wrote a book. I loved all of his fictional books. When I went to the University of Michigan, he actually came as a writer in residence once. And he stood up in front of everyone and said, "I don't like what they're making me do, so I'm leaving," which of course made me love him even more because he was irreverent.
Yeah.
One of his concepts is as you move through life, there are souls that you intertwine with and you evolve together. And he called that a karas. So the physician that we have on the show today, Dr. David Rosensweet, I think he's part of my karas and I'm part of his karas. And we wanted him to be on the show because he's been, besides we're both graduates of the University of Michigan, he went to med school at the University of Michigan, and he's been practicing hormones for many years. And he practiced part of his career in Santa Fe, New Mexico, where I met him because he practiced for a while then. Now he's practicing in Florida, and I might be soon partially practicing in Florida because our karasses are kind of overflowing with each other. He has developed an absolutely genius method for disseminating hormones to women to keep them younger longer so that morbidity of aging is compressed into a further time of life. And he calls that the menopause method. And he also has been working with a whole program called, which I love the title, I Wonder Doctor.
I wonder, doctor.
iwonderdoctor.com. But why we have Dr. Rosensweet, especially on the show today, is to inform you of what is going on with regulatory potential for our access as patients to bioidentical hormones, and for pharmacists and for doctors for their prescriptive rights to bioidentical hormones. A few minutes before I started the show, I got an email from A4M, which is one of the higher certification boards that trains physicians and nurse practitioners how to be a functional doctor. I, as you all know, lecture for them. They sent an email out saying A4M, that's the name of that organization that trains practitioners that want to belong to the functional tribe. They're joining forces with PCCA, that is the other group I lecture for, and they train compounding pharmacists. They make a lot of the bases for the creams. They make a lot of the products. And they're also joining with the Alliance for Natural Health, which is one of the biggest consumer organizations we have to be watchdogs to protect our rights. In fact, in 2007, when estriol was going to be banned and pulled off the market, and many of us believe when you take estrogen replacement, it should be combined with estriol because it protects the action of your other estrogens. It was 120,000 emails that the Alliance for Natural Health inspired in women to send that really help protect our rights to estriol. So A4M is joining forces with PCCA and the Alliance for Natural Health to protect your right to prescribe compounding bioidentical hormones as doctors, and to protect the rights of women and gentlemen to keep getting them, and to prevent untenable and unnecessary FDA regulations that would severely restrict access to what we call bioidentical hormone replacement therapy. So we all have to work right away. That there's a survey that we could fill out. There's one for consumers, one for pharmacists, and one for practitioners. All of these links where you can fill out these surveys will be in the show notes, and we need to fill them out within the next few days. And that's why Dr. Rosensweet is on this show, to tell us what is going on and why we only have a few days to fill out these surveys, and why we're even all gathering together to protect our rights. So the National Academy of Health Sciences is holding 3 meetings to discuss the regulatory action of all this. And at the second meeting, Dr. Rosensweet was one. They invited him to go testify. So welcome to the show, Dr. David.
Thank you, Dr. Lindsay.
How is it that you got invited to testify? That was really like a big honor.
I thought it was a miracle. I thought there was angels that descended upon them. I don't really know. I got a call out of the blue. I have a lot of, I'm fairly well known in that bioidentical world, and I think they ran across my website and called me, and they interviewed me for an hour, and at the end they said, "Okay, we'd like you to come to Washington."
But you were only given 5 minutes to testify, right?
Yes, I was.
And then there were some pharmacists. One of the guys I tend to lecture with at A4M and PCCA, Jim Hansier,
Yes.
he runs Las Colinas Pharmacy outside of Dallas. So he was also testifying, and there were a few other people. And so, what's the lay of the land? Why is this happening? Why is there a battle for our rights for bioidentical hormones?
Well, I think there's several reasons that are publicly known through the FDA. And that there's other reasons, and I think the other reasons are more pertinent. And, the reasons that I think they are concerned, and this is what they state, the National Academy of Sciences, Engineering and Medicine, and the FDA, is that the bioidentical hormones are not regulated by the FDA. And there are FDA bioidenticals, so why not choose those? Why allow the compounding pharmacies to do this? This is the reason for this committee that's assembled. And that's their main thing. And why in the world would anyone choose to have compounded bioidentical hormones when indeed you could just have FDA-approved bioidentical hormones? That's their reason for existence. Now, that committee meeting that I attended was tasked and funded by the FDA, who had quite a presence at these 3 meetings. And,
the third one hasn't happened yet, has it, or has it?
Yes, it has, yeah.
Oh, it has. So all 3 meetings have taken place. Okay.
Yes. And the issue is actually driven by other forces. And this is what I believe. And may it not be so, but I believe it is so. That for some reason, the freedom of choice does not reign freely in America. And the pharmaceutical industry had the most popular and profitable of in the history of medications was horse urine-derived estrogen, Premarin and Prempro. And in
Prempro was a combination of the horse urine plus medroxyprogesterone acetate, so a synthetic progestin. So those were the biggest selling drugs of any drugs in the whole history of pharmaceuticals.
Yeah,
those
for
were
years.
Boon of money, yes.
Yes. And then in 2002, when the Women's Health Initiative came out with false findings, who in the world knew that was going to happen?
Right. That was a real fiasco.
They were the ones behind the funding of that study because they were trying to expand their market share.
Right. They thought this double-blind study would prove that hormones were even better.
Yes. And they were. That was actually true because they knew and doctors knew that women who took hormones did better around heart attack and stroke, had less of them. So they were trying to expand the market share, as I understand it, and to include more doctors prescribing these. And instead, the WHI had these crazy findings that most of the WHI committee did not support because they weren't scientifically significant, but an explosion took place and out comes this finding that women are at greater risk if they take the hormones. Now, it turned out they weren't at greater risk if they just took Premarin.
Right, it was only the synthetic progesterone.
They were at lesser risk for getting breast cancer if they took Premarin. It was if they took the Prempro. They had a 1.29 increased relative risk, which in the original WHI said this is statistically insignificant, which means it doesn't count. But that's not how the public read it and how the press read it, and it exploded out there. And to the utter aghast of everybody, the Premarin market share plummeted as women got terrified in taking hormones, and so did the doctors, and they are to this day.
I have a whole chapter on that in Safe Hormones, Smart Women. But what blows my mind is that the CEOs of the Premarin company, and the Prempro company saw the light that this study, the Women's Health Initiative in July of 2002, made everyone fearful of hormones, even though the estrogen-only arm showed that women had less breast cancer risk once they reanalyzed it. Women still were fearful of getting breast cancer if they were on hormones. So those guys started a brand new company called Medical Therapeutics, and they designed their own FDA-approved bioidentical hormones called Replenish, and they just published their third phase trial in NIH, and they're writing that bioidentical hormones are safer than horse urine.
Brand new, hot off the press.
It just July 8th was their third publication.
That's for sure.
and now they're going to say those are the only safe bioidentical hormones to get. Right. And those ones are FDA approved. So why should you go to a compounding pharmacist?
Exactly.
So why should women go to a compounding pharmacist?
Well, it primarily is within the practice, how bioidenticals are prescribed. And one major reason is, long ago, it was brought to the light by Jonathan Wright, that estriol, one of the hormones native to the output of the ovary, in fact, there's twice as much estriol, or at least as much estriol, is there the sum of the most potent estrogens, estradiol and estrone. The woman's body naturally produces estriol, and it cycles through a cycle. So the first part of the cycle, estradiol predominates and leads to proliferation of breast glandular tissue in preparation for a possible implantation and possible lactation ultimately.
Possible pregnancy, possible breastfeeding.
And if there is no implantation, the second half of the cycle is a deproliferation. Cells disappear. And this is guided primarily by an estrogen receptor site beta that you know so much about. And it's the deproliferative, and the preferential hormone that stimulates deproliferation is estriol. Deproliferation in the world of breasts. We don't want proliferation in menopausal women. We want deproliferation. And if people go to the link of what I presented, there's a 5-minute presentation I did, and the link is on your website to the committee. That's one of the things I stress.
So you're saying that the FDA-approved bioidenticals don't contain estriol. They just contain estradiol. And estriol helps keep estradiol acting safer rather than naughtier. And I know a lot about this because I was a scholar at Tulane, and I worked with Janaki Gustafsson, who at the Karolinska Institute in Sweden discovered estrogen receptor beta. And in his Swedish accent, he would say, ER beta protects the breast. So you want to have the hormone estriol that signals ER beta, but the FDA-approved bioidenticals only contain estradiol. They don't contain the protective estriol.
And that's one of the main reasons. Now, the FDA also has approved oral estrogen. And any bioidentical hormone prescriber knows that that's risky. I mean, I remember I worked for Planned Parenthood for 3 months when I finished my internship, and I thought, oh, this is the cushiest job I'll ever have. They're young, healthy women. But I resigned after 3 months because I thought giving hormones to young women who are already at the peak of their hormones, something does not feel right about that. And the hormone were the birth control pill. And the birth control pill has pure estradiol in it. Well, it actually has
ethinyl estradiol,
an altered form called ethinyl
endocrine
estradiol.
Disruptor, yeah.
And every physician who's ever done any work in this field knows that a certain number of those women got thrombophlebitis and a pulmonary embolus. These young women, among other possible complications, and we track that back primarily to the fact that estrogen was given orally, because when you give estrogen orally, you wind up increasing clotting factors. Right. You also wind up increasing inflammation. And this is well documented in the medical literature. So why in the world would anyone give a woman oral estrogen?
You know, the new Replenish that were saying, the old CEOs that couldn't make market share anymore on the older hormones because the Women's Health Initiative, their new FDA-approved Replenish is oral.
Yeah.
Yeah.
And so this is another thing that I really pointed out to the committee. This is why, well, here's the facts. A 2016 study done by traditional physicians wondering what the heck's going on out there discovered that half the women in the United States who are being treated with hormones for menopause are choosing bioidentical hormones. That is a big revelation. It was very scary. And one of the things they also investigated is, why are they doing that? Why in the world would they do that? They have to pay out of pocket. Insurance doesn't cover most of these.
Right, and half of them are willing to do that. Why are they willing
to do that? And there are reasons. And one of the other reasons that came out is increased time spent with the doctor or nurse practitioner, or in some cases, the pharmacist. And what's going on in that increased time? Is it just bedside manner? No. Women are not going to pay for bedside manner. You know, everyone likes a friendly doctor, but they're not going to pay extra money for that. The reason is, in the old days, a woman would go into a doctor's office and she would say, I'm having hot flashes, and the doctor would write out a prescription immediately for Premarin or Prempro or something like that. In fact, that's still going on in the traditional world. Well, that works. You know, it's given a lot of benefit, but it isn't ideal medicine. In fact, most of the women will do pretty well and even have less of a risk for breast cancer being treated with Premarin or Prempro, for example.
Right, we talked about Avram Blooming is the oncologist, hematologist in California that's been treating breast cancer patients for many, many years. I interviewed him for the first edition of Safe Hormone Smart Women with Premarin, horse's urine, and showing no increased risk of breast cancer. And a lot of those women feel better. So, but he didn't want to be in my second edition of the book because he doesn't believe in bioidentical hormones.
Yeah.
What's going on in the
head? They can also be treated with Prempro. And, you know, I keep wanting to call you Devaki.
I have such an existential identity crisis.
It's your Karas name. This is a little bit of a sidetrack, but it's very relevant because the FDA thinks this is a very justified project that they're doing, shutting down compounded bioidentical hormones, because they still are lumbering under the fear that estrogen increases the risk. They're still living under the WHI, even though
that wasn't the truth.
So they think their mission is really important. And, you know, if it were true, I would understand that. But by 2006, they already published data showing that Prempro did not cause an increased risk. In fact, it caused less of a risk. By 2006, this was published. By 2017,
you mean 2016? You mean 2016?
No, I'm sorry, 2006.
Oh, 2006?
Examination of the data, and Dr. Blooming points this out, is they kept on following the women who were on Prempro, who they claimed had a slight but statistically insignificant increase in risk. Statistically insignificant means there is no increase in risk. Those women, even that 1.26 reduced to 1, which means they're at no risk, and even went below risk. By 2006, they knew that, and that was published. But no one heard of that. Who heard from the popular press that, oh my goodness, the hormones are safe. If you're treated with Premarin or Prempro, you have less of a risk of getting breast cancer. Nobody heard of that. By 2017, some of the original... I
did write about it in Safe Hormones in 2010. I must just give myself a little pat on the back there.
Big pat, early. That's huge. And then by 2017, some of the original writers of the WHI admitted in an article that they printed and was published in JAMA, the Journal of the American Medical Association, that indeed, long-term follow-up of women treated with Prempro did not have an increased risk of breast cancer or cardiovascular disease.
Well, that should have ended don't get this news. Doctors don't get this news. Everybody's so fearful, and they don't realize that hormones actually reduce your risk of breast cancer. They do not increase it.
And and you know, with all due respect to the PhDs and medical doctors that are on the committee, it was my opinion, and I would have to have that confirmed, but they didn't realize it either, as did hardly anyone else in the room, And, it's just trickling to the surface in Dr. Blooming's book, Estrogen Matters, which we recommend to any woman who has any concern left in your being about hormone treatment. We're all at risk. Women are at risk for breast cancer. I'm at risk for a lot of different cancers and a lot of different stuff. But we're at less risk if we're treated with hormones rather than no treatment at all. So the reason I wanted to sidetrack on this is this fear permeates that committee, and they feel like they really want to get rid of the people that they think are out of integrity. And in the committee, the majority of the presentations, the time was given to examples of people who were out of integrity and did require policing. They were the fringe. There's fringe attorneys, there's fringe garbage men, there's fringe store owners. They're doing bad stuff. But the vast majority of those in the middle are doing lovely work.
So you're saying there's some fringe pharmacists, there's some fringe physicians, and those were the ones that got the bulk of the time on the con position where we should block the availability of bioidentical hormones. But if they really look at the majority of the treatment, women are willing to spend more money to sit in front of a doctor or a nurse practitioner for the longer period of time because they're really looking into their whole life, their diet, all the different things that affect their hormones. They're having more balanced and individualized care.
Exactly. And
right.
that's the statement. And just to give you an example, and you've written books on this, that when you start describing the care of proper treatment of women in menopause, it's quite a process. You take someone with diabetes and they go to a doctor, and no doctor is going to say in 10 minutes, oh, you got diabetes, do this, and bye-bye. No, they're going to take you through a process in which they monitor the drugs and make sure your blood glucose. And menopause is like that very much. And women are so individual. Oh my God, women are so individual. And this is the third major point I brought to the committee, that there is no one dose fits all or two dose fits all. It takes a process to figure out the optimal dosages and then test for those optimal dosages and monitor through mammograms and bone density tests. The whole thing's a process. Just to give you an example, we have a certification program. And the doctors who are in our certification program...
That's your menopause method program, yes, right? Okay.
We give them a major education that's available online. It's 13 hours plus a whole bunch of testing. And then they have to review every single case with me that they have. And how long do they have to do that? 2 to 3 years. Why? Because there's a lot to the body of knowledge of treating a woman properly to lead towards maximum safety and risk reduction and optimal benefits. It's quite a process. And that's one of the reasons the study pointed out that these women were choosing bioidentical care, because the vast majority of mainstream bioidentical prescribers, physicians, nurse practitioners, and some pharmacists, they're providing excellent care. They're taking time to do the proper testing and monitoring and figuring it out. And because women are so individual, and this is the main reason for compounding from my perspective, you couldn't produce by manufacturing process the actual number of milligrams per milliliter and ratios of biased alone.
That's biased is the estradiol plus the estriol. So there's 2 estrogens. So it's referred to as biased.
And not only that, you've got to get the ratios of biased and of estriol and estradiol correct.
Right.
And you just couldn't produce the number of individual prescriptions. They all have to be customized. That's
right,
not
so even mentioned. The replenishes, they say they have 4 different dosages of all oral estrogen, progesterone, but that doesn't cover the hormonal footprint of all women. We have all our own hormonal footprint.
And that's what was startling for me when I went into practice. I mean, I had the basic knowledge, but women were so individual that I had to walk through the process. Everybody is. Men are individual too. But I had to walk through this extensive, careful process to arrive at the optimal dose. And our guiding light, our mission statement is make this as absolutely safe and effective and elegant as is humanly possible. We can't eliminate risk. None of us are at a zero risk position. I'm happy I got up this morning and got out of bed and walked and talked, and I'm talking to you now.
Life is a risk. Taking a breath is a risk.
My goodness.
Being on balanced hormones minimizes the risks.
Big time.
Such a higher quality of life. I would not be, having been a DES daughter and had to go through all those earlier surgeries, all those cancers, I'm missing 7.5 organs. Organs give you a lot of circadian rhythmicity with the planet. They give you your organic physiologic mojo. Without balanced hormones,
You don't seem to be diminished in mojo too much.
I think I believe a lot of who I am, besides my lifestyle, is because of hormones. And it scares me to heck to think that my access to bioidentical hormones
absolutely
minimized.
And that's very, very significant because I've heard the statement out there, well, I'm just going to go through natural menopause. Well, it's not a matter of risk. It's almost a certainty that the woman will be at significant risk for losing bone and muscle and vagina and bladder, and will lose so much of those that they will eventually turn to a cane, a walker, and then the defining moment, the wheelchair, where they can't be taken care of at home and they have to go in a nursing home just because they had a natural menopause. And I do testing of women from their 30s to their 90s. And let me tell you what happens to hormones. They just don't stop getting lower at menopause. They keep going and they approach zero in the ultra elderly. And the outcome is disastrous. So there's epidemics of osteoporosis. And that's not even to mention the mind and cognition and the arteries.
It blows my mind that the Cache County study was the most amazing study. There were usually you have a study. So the study was prospective. They looked at about 7,000 people starting in their 50s in Cache County, Utah, and they followed them into the future. That's a prospective study. And they looked to see who got dementia, who lost their mind, and who didn't. And what were the significant factors of protection on the people who didn't? And they controlled for confounding variables like smoking and exercise, blah, 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 blah. So they spun off about 40, 50 papers off of this. And each of the papers said that if a woman had been on estrogen for 10 years, some papers said she reduced her incidence of Alzheimer's disease by 50%. Some papers said 40%. If anything else said that you reduced your risk of Alzheimer's by 50%, we would all be running out to get it. And there it is. It was estrogen replacement. And it had to be for a hunk of time so her brain could be protected.
Oh, my goodness. And how important is that, what you just said? And then anyone who treats patients, and you know this, what are the chief complaints when a woman goes into menopause? Is it hot flashes? No, women are strong. They do fine with hot flashes. If the hot flashes occur in the middle of the night, it disturbs their sleep. But it is loss of cognitive function, is weight gain, loss of mood, loss of energy. This is why the women are showing up wanting treatment. And you know what? It's real.
Overwhelmed. They all feel so overwhelmed. They have all these things that they want to do, need to do, hope to do, and they can't get them done. Right. And hormone replacement, balanced hormones, really make all of those things a smaller font size in the more distant future. It's so true.
Yes. And
we need access to these.
And the issue of just taking 1 or 2 pills or a patch and prometrium, oral progesterone, it just doesn't cut it. Because I can tell you for sure, having tested thousands of women and looked at their hormones, you got to get that balance right. And you cannot get it right with 1 or 2 choices or 4 choices or 8 choices. You have to individualize. You've got to change the milligrams per milliliter and the ratio of biased, progesterone, testosterone, and DHEA, and probably thyroid. And there's
and oxytocin. More. Yeah. You know what's so interesting is also a hormone is not a hormone, is a hormone. They vary. So, for example, prometrium, which is insurance reimbursed and comes in 2 dosages, 100 milligrams and 200 milligrams.
Too high.
It is 20 times larger a molecule than most of the progesterone made by compounding pharmacies, which are very smaller molecules, so they're more available for the body to use. So a lot of times a woman will take a larger molecule and she says, I don't feel any difference, or I feel worse from it. And when they take a compounded hormone, it could be smaller and more bioavailable, so you're more apt to get the result that you want.
And there's other stuff in that prometrium capsule. There's red dyes, there's toxic metals in there. There's peanut oil. Those things are in peanut oil. I can't imagine how they get away with that. There's so many people with peanut allergies.
You know, every time I've tried prometrium, just because some of my patients take it, I've gotten vertigo. And it's
too much. The dose is too high.
Is that what that is?
Yeah, that's what it is, yeah. And we're not here, and I really would like to emphasize this to all women and the committee and the FDA. I'm not here to shut down or oppose the FDA or choice for women to go wherever they are. I am very well aware of how many women benefited over the course of 30, 40 years by taking Premarin and Prempro. Not something I would ever prescribe, but there was great benefit there. We're not here to oppose them. We're only here, and the action that we want with the committee is to preserve the woman's ability to choose who she's going to go to for her hormones and what type of hormone she's going to take. That's all we want to do. We're not opposing anybody. Congress passed a law, the Drug Quality and Safety Act, which was supposed to protect and preserve compounding pharmacies a right to do compound medicines and hormones. And that was passed and signed in 2013. Congress passed the law. One of the things that's happened is the FDA has overridden that law. And so they've leaned right into it, and they've brought in some egregious constrictions on that law that's made it really hard for compounders, and they keep going. And my concern about this committee and why I so much want to appear to them and appeal to the part of them as a genuine scientist and physician that have taken the Hippocratic Oath and ascribed to the scientific method is, let's look at what's really going on out there with the mainstream of compounding pharmacists and prescribers. It's wonderful. It's 20, 30 years ahead of where the pharmaceutical manufacturers have just picked up the mantle of bioidenticals. They're just beginning. But the whole science has moved, and the experience base, oh my God, the experience base has moved forward. And this is common in medicine, where the best ideas don't really emerge for 20 to 30 years.
It's so funny because in business that wouldn't happen. Things are facile in business. They take off. But in medicine, there's a trickle time of 20 to 30 years before things show up in the clinical trenches. And so you're practicing a sophisticated, individualized, safe, science-based medicine, and women are aware of this. Half the women that are on hormones in the United States are on bioidentical hormones, and we appreciate your efforts and your passion to try and help protect our rights to stay on the hormones that we choose to stay. If other women don't want to be on bioidentical hormones, they don't have to be, but we would like the right to be able to get prescribed and have that time with in-depth, functionally oriented docs, because we believe in individualized medicine, and we believe that it'll help keep us younger longer.
And safer. And more elegant.
And more what?
More elegant.
Elegant. Oh, yeah. I like that.
Yeah, I mean, when you
that
do
is so
everything
true.
right, and it looks to me that who's ever doing your hormones, and maybe yourself.
I do them myself.
That's what I thought. You got a nice mix going on there.
I just was in Salt Lake City, and my girlfriend, Martha Bray, has this wonderful clinic called the Advanced Health Clinic, and they have this energetic machine called the HRV machine, and you hold on to it. I've never been tested, and it tests all these things. It tests your hormones, your brain. It tests all these And everyone knew about me. My books are all over the clinic, and they were all waiting with bated breath to see what my hormones came back on this HRT test. I was a little nervous.
Yeah, really.
They came out 100. They came out 100. Everything came out 100, but my heart chakra was in the toilet. So I need to go party more.
We all have a frontier, don't we? Definitely got mine. Since we're in the same crevasse, I understand that heart chakra issue. Would it be all right to mention to the women what the action that they can take? Because I can tell you, action is really required. This tidal wave is moving towards us, and they're serious, and they've got big money, and there's a lot of push and pressure to eliminate bioidentical hormones. And we're working, there's a wonderful coalition. And as you mentioned, A4M coming through Sahar, and the Alliance for Natural Health. There's wonderful allyships in the PCCA. There's a
Suzanne
coalition.
Summers, Jonathan Wright, yourself. Now I'm part of that group. We're
Absolutely.
all trying.
You're on the coalition, and there's some patient
get everybody to help us.
They spread influence, and it's wonderful.
So yes, tell us what people can do. And then we will have these links in the show notes and also on my website at drlindseyberkson.com. If you can get to the show notes at drlindseyberkson.com, you can get to them from iTunes, but all of these steps and the links to get to them will be there.
Thank you. Yes. And here's the 3 action statements that we're currently implementing. Number 1 is the committee of the National Academy of Science for Bioidentical Hormones has put out a survey. And Dr. Berkson has a link to that survey for patients and also for compounding pharmacies and also for providers. And if you fill out that survey, it's going to go directly to and they're asking questions like, do you have any input? What do you think about bioidenticals? And their final question is, what would you like to say about bioidenticals? They're open to feedback. And the timeline, the deadline, which they were very kind, and they let us extend the deadline, is this Friday.
Right. We only have a few days, and it's only 10 questions. The whole survey takes you a few minutes to do, really quick.
If you want to pass this on to a friend, copy the link, email it to the friend, and then open the link. Don't open the link.
Link issues. We have link issues here.
Yeah, don't open the link, or you'll be done. And it's proper. It's a proper way to conduct a survey. Now, that's
you open the link and then send that same link after you've opened it to a friend, then they can't open it. So you have to first copy. Once you open the link, you have to finish the whole 10 questions. You can't go back to it later. Once you've opened that link, that's all you get. The way that their whole sophisticated machinery works, it only gives you one opening of that link. So you want to share the link with other friends first before you open it. Then when you open it, you need to finish the 10 questions before you submit it. That's important. Otherwise, you lose your chance to have input.
And they don't want the ballot box stuff, so we understand why they do this. But go in there, listen to what she just said, please. And then that's action number 1. And the committee's going to get a lot of feedback from the public and from providers. And here's action number 2. We've paid a lot of attention to what's going on in this committee. And there's a whole coalition of us who have. And we feel enormously unrepresented. A lot of negative, and you mentioned this earlier, but a lot of negatives were given the time. In fact, we feel like the preponderance of the time were given to these negatives. And someone like me, who was the only physician there that was an active practice treating women in menopause with hormones for 25 years, I was given 5 minutes and a few questions. We want to balance the time. So in about a week, there's going to be a second action. And the second action is it's going to be a petition to request that Dr. Rosensweet gets invited back to the committee and is given ample time to balance the negative feedback. Because I've been working for a month and a half on fine-tuning the presentation to this committee, and it's going through a lot of our colleagues. So this is a synergistic work because we could tell, all of us, that these are PhDs and MDs. They're knowledgeable people, but they don't treat women in menopause. So their knowledge about the field, even anything, is very limited. And we want to give them that education because they're trying to make determinations and they don't know what they don't know. And because they don't know what they don't know, they weren't generating the questions and the challenges to some of these negative people who were coming up there. They were making these rash statements, and everyone's so committed to citations and literature, and no one was asking them. You just said, we never use bioidentical hormones. Why?
So now, let me just summarize this. First of all, you're saying the committee was made up of MDs and PhDs, none of who treat hormones and none of who use bioidentical hormones on patients or themselves. And if I have this right, just let me know if I have this right. The people who are presenting the cons on the fringe, more the fringe problem of providers of issues with hormones, they got about 12 hours of showtime to give all of these negative stories, whereas PCCA and yourself, if you added that time up, got about an hour and 35 minutes versus 13 hours. So it wasn't fair. And we would like to give them access. You know so much. You have been in this field so long. You train doctors in hormones. The second action is to petition to have you go back and educate that group of MDs and PhDs so that they can understand more, so that we have a better chance at protecting our rights to bioidentical hormones.
Exactly. And you can see when Lindsay and I start talking, I mean, this is a big field and there's a lot to say and it's very exciting, and they don't know any of it and they don't know what they don't know. And these are earnest, educated people, some of whom have pledged to the Hippocratic Oath, and the others who are devoted to the scientific method. If they would just follow that, that will take their hearts into re-examining this pressure and easing off on it. If they'll just go for that, the integrity of what they've given an oath to, it'll work. And then we've laid out that program. So action number two. Action number 2 is, and I think you're going to post this on your website, that within a week, and if you're open to it, I'd be delighted to come back and talk about the second action, but there's going to be a petition that's circulated by the Alliance for Natural Health and Lindsay and all, and we're talking 20, 30, 400,000, 600,000 people are going to receive this. And we think if we flood the committee with that request, and I know who to send it to, I know the point person on the committee. She's a PhD and she's very smart and she really is good at logistics. We'll send that petition and see if they can get me back to give them a basic education.
Let me just ask you, before you go to the third action point, if there was worst case scenario, if none of this worked, what would the world look like? When would it happen and what would happen to us? When is this set to go into play if it was worst case scenario, just so people can understand what we're trying to stave off?
Well, the really uncomfortable news is a lot of it has gone into play, and it's going to appear in your local compounding pharmacist, the smaller ones, really quickly, because even though women stopped the estriol ban in 2007, that didn't stop the FDA and the USP committee from marching into doing some major work. And what they did is they came up with this USP 800, these guidelines that the compounding pharmacists are now required to follow. And it's egregious restrictions. They're ridiculous. And the bottom line is it translates into a small compounding pharmacy in your neighborhood. There's 7,000 of these at least in the United States. Think of all the employees. Think of all the wages. And these are the best pharmacists that are out there. They're the ones who love pharmacy.
Compounding pharmacies are the best users.
$250,000 in putting on these new additions in these new rooms that have negative pressure, and they're wearing something close to a hazmat suit for ridiculous reasons that I could explain if you want why they came. And the bigger pharmacies are paying $750,000 minimum. just to conform to these new regulations, which are now in place. And the world is just getting, the compounding world is just realizing they've got to come up with the changes. We learned about it 4 years ago, and of course, Jim knows all about this, and they've been preparing for it for years. But it's going to take out the small compounding pharmacies. So I'm not answering your question as you posed it. I'm saying it's already happening, and it's very severe. Because this who's ever behind trying to stop bioidentical hormones that are well-funded.
And isn't it, now you probably don't want to say this, you want to go back in front of the committee and be very politically correct and everything. So I'm just going to put this really gently, but it's basically, in my opinion, I'll own this here. It's all about a battle for the dollar. Because big pharma doesn't want these compounding pharmacies to be getting all this money. If half the women in America that are on hormones are getting their hormones made by compounding pharmacies, and now what they're wanting is to have replenish another, it's a battle for the dollar. And unfortunately, it's the consumer and the women that are being harmed, the compounding pharmacists that are being harmed, and the doctors that want to take care of women in this individualized, more sophisticated, time-oriented manner will be harmed. But what would happen if the rest of it went to fruition? That what we're battling, so you really want you to be so motivated to fill out those surveys, and then for the next part to talk to your congresspeople. Would it be that we could no longer have access to bioidentical hormones? That's it. They're illegal. Is that
they're going to be forced out of business? That's right, and that's where they're heading. And I must tell you, you know a lot of folks that have been doing this for decades and decades, and so do I. And there's a certain percentage of them that are fairly pessimistic. And I heard from one erudite, brilliant provider that said to me, it's probably going to take the pain of the total loss to get the kind of mobilization that we need. And God forbid that happens, because that may be unstoppable at that point. So what we're trying to do is do this mobilization now.
Right.
That's what I said.
That's why this show, that's why you're hearing this, that's why this survey, you need to act with us.
Yes. And, the Revolutionary War was won by the United States. The Civil War abolished slavery to a certain extent. The women received the right to vote. Big things have happened. The Civil Rights Movement moved the bar further on down the line, not so far as we all want, but big things happen. It works. If citizen pressure, to the extent that our democracy is still alive and well, to the extent that it is, we can make a difference. And I say, now is the time. Oh my goodness. And so
I put this up yesterday. I wrote somebody that I know has a really huge email list. And I said to her, she's very big in cyberspace in the health field. And I said, would you put this out to your tribe? And she said, oh, I've heard this before. I've heard that bioidentical hormones are at risk before, and I don't really believe any of this. She didn't want to hear it. And that's not true. This is really real.
Yeah, I'm so sad to report that. But you talk to anyone has so much of their career and their time and energy close to the bone in this field, and they're going to say the same thing, that it's like never before. And the risk is really close. And if this committee comes out with a negative report, well, I've heard opinions that said this is what they're designed to do. And then the FDA will have their reasons. The Committee on Bioidentical Utility reported out that they weren't okay, and now we can shut them down. The final nail in the coffin, so to speak. We're at risk for that, but we're dealing with human beings. This committee is made up of human beings, and there's human beings in the FDA. And, if right is
didn't some of them at the end of your testimony go to some of you in the back of the room and say, hey, I know that we can't make them legal at this moment, but boy, they sound really good to me. And maybe you can talk to my doctor. I think I'd like to try going on bioidentical myself.
That was fun. And Jim, of course, was the one they approached. Yes, because this is the real deal. And that's the thing. And why do half of American women choose this? Because they know the real deal. And so What
It
more?
terrifies me because I honestly would not be who I am. I was just lecturing for PCCA in Canada, and I didn't realize that bioidentical hormones were so limited there. Functional docs are being attacked. Socialized medicine doesn't really support this. And so really as a country, they don't have access to bioidentical hormones to the level that we do presently at all. And their medicine is very different than, they do have medicine to the masses. They do have effective medicine to the masses, which we don't. But the type of medicine they have is very different, and they don't really have access to bioidentical hormones like we do. And I actually saw a family member that I hadn't seen for 11 years that's much younger than me and looked 20 years older than me. And there's a big difference there. Many things, but
why don't you reveal your age?
No, I don't want to reveal my age. I still lie on Match.com.
But it's spectacular.
I know, but I don't.
And this much health is spectacular.
Thank you, darling.
You said, and that bioidentical hormones are a big part of that.
Everyone says to me, what do you do? Of course, I say, what do I don't do? But the biggest thing I do is bioidentical hormones. And I had breast cancer 26 years ago. And every time I go in, every few years I go in to see a surgeon because they have the best palpating hands because they feel breast. Right. So I always go get palpated by a breast cancer surgeon. And every few years she says the same exact thing to me. She stands back and she says, you look better than any single breast cancer patient I have that's over the age of 50, and stop hormones. And it's a litany. It's a mantra. She says this to me every time. And every time I go back there, she's getting older and older. So now it's been 26 years. She looks 20 years older than me, and she's decades younger than me. Not that I enjoying that fact. I always encourage her to consider hormones, but she thinks estrogen causes breast cancer. She's a surgeon.
Let's clarify that. As Dr. Blooming points out, who's an oncologist and an expert in breast cancer, that a woman who has had breast cancer and is treated with, and has the breast cancer treated, is at less risk for recurrence than a woman who is not, I'm sorry, let me state that again, I apologize. A woman who has had breast cancer and has had the breast cancer treated, if that woman is treated with hormones, even Premarin and Prempro, she has less of a risk for recurrence than a woman who is not treated with hormones. A woman treated with hormones who had prior breast cancer is a less risk for recurrence than a woman who is untreated.
This is so huge. This is so huge because even at A4M, they stand up there and they say, although they're softening it a little bit because I'm part of the team now, they say if you've had breast cancer, you can never be on hormones. That's what everybody says. And that is not the truth. I have a little teeny booklet on my website now called Hormones for Breast Cancer Survivors. And I go into some of this, at least the studies that have been done on testosterone and aromatase inhibitors. But there's so many ways to take hormones. And I have had a few patients come in to see me in their 30s that had breast cancer. And I've been told they have had everything removed and they literally start getting dementia. She had to put little stickies on her mirror in the bathroom to remind herself to brush her teeth. She brought her husband in. She looked like the grandmother to her husband. She was begging for hormones. So in the beginning, we started to give her hormones. I was working at the Wiseman family practice, and then they got worried about the litigiousness of losing their license. And this woman went back into early dementia in her 30s. And it's a complete misunderstanding. I didn't think that the conversation would go there, but I feel this so strongly because I've had breast cancer. I'm allowed to be who I am because of access to bioidentical hormones. But so many women who've had breast cancer don't have that access, even with them available, because doctors think they're afraid. They're afraid.
And just so we emphasize that, if this is a risk for you, read the book Estrogen Matters. It's a science, medical literature tour de force that shows the literature that shows you're safer if you get treated with hormones. You're at risk for recurrence. I'm at risk for a lot of things. But your risk for recurrence of the breast cancer is less if you are treated with hormones than if you're not treated at all, or if you're treated with tamoxifen. Go figure.
I have in Safe Hormones, Smart Women, I have an entire chapter on hormones and breast cancer, and I reviewed all the literature, and even women who had the BRCA gene, who were
Right.
given estrogen, were better off than the women who had total prophylactic hysterectomies and mastectomies. So it's such a misunderstanding, and I'm living it. I'm not just saying it.
Yes.
But it's funny that it went there. But it's the bottom line is that hormones are the most misunderstood genre of medicine, but we don't want to shut down the store and lose our access. So because of your efforts, I know you worked really hard. They invited you, and Jim told me that you rehearsed those. You only had 5 minutes, so you rehearsed the heck out of it to use every single
second. I had 100 hours into that 5 minutes.
Isn't that something? Because you care so much, and you've seen what it does in practice.
Yes, exactly.
Women. So we don't want to lose that right. So what's the third action that we can take?
Well, that's if you stay connected with Lindsay, you're going to see these appear at the proper moment, so you don't have to memorize them. Right now, your task is to go to Lindsay's website and click on the link for the survey and fill out that survey. Or first, don't click on the link, send it to a friend, copy the link, send it to a friend, and then you click on the link.
And I'm also going to send it out as an email. So if you go to my website, drlindsayberkson.com, and sign up for my email list, I'll be sending it out in emails. And I'll also find out where I'm going to be putting it on the website. Remember, we only have till Friday to fill out this survey. Today is Tuesday. So we only have a few days. So we have to be very, very, you have to drink a cup of coffee and then go to the link.
And then action number 2, it will appear. You're not going to have to go looking for it. It's going to appear on Dr. Berkson's website. And it's going to be a petition in which the language is going to say, or you can put any language in there you want, to get Dr. Rosensweet to return to be able to speak in front of the committee and being given ample and balanced time to give the basic groundwork that they don't have. They don't look at what you and I have been talking about this whole time. They don't have any of this, and they don't even have the basics. And they're going to make a decision that's going to affect 2 million women. That's how many women we're talking about. So the second action is to sign that petition when it appears on a website or in your email that sends Dr. Rosensweet back to Washington. And then there's a third one that's going to come down. We're waiting for the dust to settle on each one of these actions. The third one's going to be a petition designed by the Alliance for Natural Health, and I'm sure A4M is going to carry it, and PCA is going to carry it, and you're going to carry it, and we're sending it out. And this petition will make it really easy for you to either sign a pre-crafted language to your congresspeople, 2 senators and a representative. You just put in your zip code, you're signing something that's going to go directly to them, or you craft your own statement. But if you have your zip code, it's going to be made so easily for you that it will automatically be sent to your 2 senators and your representatives. That's the third action. There's a fourth and wild action that I'd just like to get a hint at, primarily because if there's any input we could have, it would really matter. And Thursday, Joshua and I are being flown.
Joshua's his son.
And business partner, yeah. And Joshua, how Lindsay and I really reconnected is Joshua was searching for experts to interview on his show, and he found Lindsay, and they had a great time together. And then we remembered, oh yes, my God. Of course, I've thought of you many times because there's such a need for this whole body of knowledge you have about receptor sites and receptor site injury from the chemicals and stuff. Maybe we shouldn't go there today, but someday this needs to be made public too, and what you can do about that. But I'm sorry, I diverted. We're being sponsored by a wonderful angel to attend the Republican National Committee and speak with the chairwoman of that committee who has some interest. So if any of you know how to navigate or know people at that committee meeting, because it's a national meeting, I hear the president's going to be there. If there's anyone that we might contact there, please email Lindsay or myself. My email address, can I say it on the air?
Yes, please.
DRR, Dr. R, DRR, at menopausemethod.com. Give us some hints. I've never been to one of these. How do we navigate?
Or
what
you
are
can
we
reach
looking
me
for?
at info@drlindseyberkson.com. So either one. And then I would send that email to Dr. Rosensweet if for some reason you didn't remember his email. So you can always reach one of us, because we need to act to keep our rights to hormones. And believe me, there's, you just said there's 2 million women on bioidentical hormones, which means there's 2 million women who are on the synthetic. That means out of all of the aging women, we're the fastest growing demographic of aging women in the United States, with all of the aging issues and the a burden on Medicare and everything. That's only 4 million women. And there's so many millions and millions of women who are denied hormones and youth and health that they could have because of ignorance and bias and misunderstanding. So that's why we become so passionate about what we're saying, because you don't have to age the way that you think aging is inevitable. It can really be softened, and it can be made a smaller font size, and you can keep so much of a higher quality of life. And look at most millions of adults are not getting access to that. They ask their doctors if they're candidates, and their doctors go, "Oh, no, you don't need that," because they don't know. And the doctors aren't on it, and they're getting fatigued and aging. They're missing out from ignorance. Yeah.
Brilliant point. The monumental level of disability that occurs from these powerful hormones, they're the most powerful biochemicals in our body, and the loss thereof, the cost to Medicare and the cost to the healthcare, because they're just not given hormones, so they don't have access to it. Wow, thank you for bringing that up. That's so huge.
Aging is basically the loss of hormone signals. That is basically what drives aging. So
it's
you can, better living through chemistry is to slow that aging down. Oh, God.
And just for clarity, I'm apolitical in certain ways. I'm issue oriented. I don't want wars. I don't want the earth to be damaged anymore. I want people to be treated nicely. So this is because I'm going to this. Doesn't speak anything to my actual politics, which are apolitical. It's for it's for the preservation of the earth and its people. That's where I'm at.
I love that's why we're in the same karass. I want to thank you so much for your time. We will get you back on the show. Please look to the show notes, look to my emails, look to my website, take action quickly, drink that cup of coffee and hop on it. People, hop in the shower, hop on this. Don't just hop in a shower. Thank you for being on the show, Doctor.
So wonderful to reconnect with you, and especially in this format. And I'm sure we'll have many conversations. And thank you very much for all that you've done and all that you do. My God, the major player here. Thank you so much for today.
On a body, mind, spirit level. Blessings. Thank you so much for what you do. And let's hope that you get back there, and let's hope we succeed. May the hormonal force be with us. Bye now. Thank you.
Bye-bye.
Bye-bye.